Hi guys, welcome back to my YouTube channel Basic Knowledge. Today we are talking about dyspnea. The clinical features of dyspnea will be discussed in this video. Usually, dyspnea usually is the first symptom. Basically, dyspnea is the symptom of emphysema, and it begins insidiously but is steadily progressive in the patient with the underlying chronic bronchitis or chronic asthmatic bronchitis. Cough and wheezing may be initial complaints. The weight loss is common and may be severe enough to suggest an acute malignant tumor. Pulmonary function test reveal the reduced FEV with normal or near normal FVC. Hence, FEV to FVC ratio is reduced. Classic presentation of emphysema with no barrel chested and dyspneic with obviously prolonged barrel chest. Expiration sitting forward in the hunched over position. In these patients, airspace enlargement is severe and diffusion capacity is low. Dyspnea and hyperventilation are prominent, so that until very late in the disease, gas exchange is adequate and blood gas values are relatively normal because of the prominent dyspnea and adequate oxygenation of hemoglobin. These patients sometimes called pink puffers. At the other end of the clinical spectrum is a patient with emphysema who also has pronounced chronic bronchitis and has a history of recurrent infection. Dyspnea usually is less prominent, and in the absence of the increased respiratory drive, patients retain carbon dioxide, becoming hypotoxic and often cyanotic for unclear reason. Such patients tend to be obese, has designation blue bloater. In some patients with COPD, symptoms fall in between these two extremes. Hypoxia-induced pulmonary vascular spasm and loss of pulmonary capillary surface area from alveolar destruction cause gradual development of secondary pulmonary hypertension, which in 20% to 30% of cases lead to right-sided congestive heart failure. Cor pulmonare. The death from emphysema is related to either respiratory failure or right-sided heart failure. Conditions related to emphysema involving abnormal air spaces are accumulation of air within the lungs or other tissues also are recognized. Compensatory emphysema, obstructive overinflation, bolus emphysema. The compensatory emphysema describe the dilation of residual alveoli in response to loss of lung substance elsewhere, such as occur after the surgical removal of the diseased lung or lobe. And obstructive is expansion of the lung due to the air trapping, and many more related to that. Must subscribe my YouTube channel Basic Knowledge.